Did you know that there are supplements proven to reduce belly fat specifically? Hi, I'm Dr. Patricia Mills, holistic medical doctor transforming women's health with root cause solutions, and welcome to the Wild Wisdom Show. Today, we're going to be talking about the top supplements proven to reduce belly fat. And actually, when you look at the research, two types of supplements really stand out, and that's what I'm going to focus on because I want to talk about the ones that actually have been proven to reduce belly fat. Now, in order to understand the first supplement, you have to think back to the episode that I did on the root causes of belly fat, also known as visceral fat or visceral adiposity, because it tends to accumulate in the abdominal area around the viscera. So, we talked about many different root causes of belly fat. And if you haven't caught that yet, you might want to go into my belly fat playlist on YouTube and check that out, because if you don't address the root causes, it'll be really hard to out supplement them. But these supplements have been shown to help even on their own. And one of the root causes was problems with the gut microbiome and gut health, as well as inflammation. Now, what we're going to quickly review here so that the supplement makes sense is that the gut microbiome, when it's in good health, your gut is in good health, but when it's dysfunctioning, when it's not functioning well, it can cause local gut inflammation, which then can cause body inflammation. And it seems to cause inflammation specifically around the gut region, which then leads to that visceral fat, belly fat increased risk. So, the first supplement that I found in the research was specific probiotics. So, probiotic are little organisms that are in supplement form, and they could be bacteria, yeast. And what they do is that when you take them in, they go into your gut and they change your gut microbiome, ideally for the better. That's the purpose of taking it as a supplement. And remember, your gut microbiome is a community of organisms, including bacteria, yeast, parasites, fungi. And what we want is for them to be in a healthy state, just like any healthy community. And so these probiotics have been studied to improve the health of that community, to introduce more of the good guys into the mix. And what research shows, and actually there's been quite a bit of research done in this, enough to be for this researchers to do what's called the systematic review of randomized controlled trials. Now, randomized controlled trials are the best quality trials that people can do, and they're very hard to do, very expensive. And they've actually done it specifically on probiotics and belly fat. That's that visceral adipose tissue. The subcutaneous adipose tissue, which we also covered in the root causes, is the kind of fat that accumulates underneath the skin in all over the body. So it could be the face, the arms, the thighs, whereas the belly fat can accumulate underneath the skin, but also inside the abdomen, leading to that internal belly fat. So that causes the the belly to poke out. So the research shows that when it comes to that belly fat specifically, certain probiotics are very effective. A couple of studies were done on the strain called Lactobacillus gasseri, Gasseri, and also Lactobacillus curvatus and Lactobacillus plantarum. Now, I'm going to give you some tips on how to find probiotics that have these specific strains, because the idea is that you need to use strains that have been shown to work for the specific problem that you have. And these strains were shown to work for the belly fat. Now, what I also want you to know is that one study did a really good job where they stopped the probiotic and kept monitoring the participants over time. And that improvement in belly fat went away when they stopped the probiotic. And what I take from that is that if you just supplement, you are going to run into problems with the belly fat coming back when you stop the supplementation, if the supplement works for you, because you haven't addressed the root causes. You haven't looked at nutrition and you haven't looked at exercise. So if you don't look at the root causes, and I'm going to give you resources for those in order to address those properly in the show notes, what you're going to find is you're going to supplement with some improvement, but as soon as you stop, the problem's just going to come back. And whatever root cause is causing the belly fat will still keep going on behind the scenes. And you could even run into problems in the future. So think of the supplement as a way to kickstart your belly fat loss, to accelerate your outcomes and results, while also engaging in the nutrition, the exercise, and the root cause solutions offered in the previous Wild Wisdom episodes, which you will find in the belly fat playlist on my YouTube channel. Now, the supplement number 2 is vitamin D3. So, vitamin D3 is interesting because it's been studied now for some time in the role of development of overweight and obesity. And these researchers specifically wanted to look at the role of vitamin D and that visceral adiposity, the belly fat. So, this research study is called Vitamin D Supplementation and its Relationship with Loss of Visceral Adiposity. And if you're catching this on the podcast and you want to know the exact studies I'm referencing, pop over onto YouTube. When you watch the videos in the banners, I put the journal PubMed indicator so that you can find those journals if you want to dive into it. Now, in the study, they took 41 participants and divided them into two groups. One group had the lower vitamin D dosage of 800 international units per day, and that's vitamin D3. And group two had 1,800 international units per day, so a higher dose. What they found was that after 12 months, the higher dose supplementation group of 1,800 international units a day, more people in that group reached the status of having enough vitamin D, which is interesting because when they went into the study, many of them were vitamin D deficient. So they had higher vitamin D sufficiency. And also, those on the higher dose supplementation compared to the lower dose had a significant improvement in belly fat compared to the lower dose group. So the dose mattered. Now, I think that would have been also useful, and this is something that a lot of vitamin D3 or vitamin D trials don't do, is measuring the vitamin D status before supplementation and then studying the effects based on who was more deficient and who was not deficient, and was there differences in effects from that. This study did not do that, but what they did do is find that regardless of what state you are in with your vitamin D status, taking 1,800 international units a day as a minimum, because there are studies on higher doses, seems to promote a reduction in that belly fat compared to lower doses of vitamin D. So, what I want you to understand is that it can be hard sometimes to source these supplements, also finding good quality ones that don't have harmful non medicinal ingredients that can harm gut health and then cause the visceral adiposity or belly fat problem. So, what I've done is I've partnered with Fullscript, which is an online supplement platform. And what I do is I go in there and I can select through my account, select the supplements I think are good quality. And in this case, contain the strains of the probiotics that you're looking for. And I put them into a community plan called the Belly Fat Busters. And if you go to the YouTube show notes, and the way you do that is when you're looking at the video on YouTube, you look below the video, there'll be some writing there. And when you click on read more, you open up all the writing that's below there, and you can click on the links. This works for Canadian residents and US residents. And so read through there. You get a 10% discount. I get a small commission if you order through them. But if you just use it as a shopping list, you can take those supplement recommendations to your local health food store or supplement store and purchase with them, just making sure that they have the right medicinal ingredients and don't have the bad non-medicinal ingredients, which are the two things I look for in addition to quality and price. So I hope you found that helpful. In addition, I am putting into the show notes the link for the belly fat playlist so you can address all the root causes of belly fat so you can get sustainable results for the long term, including the exercise, nutrition, and the supplements. This video will live there as well. So I hope you found this helpful. Please feel free to put your questions in the comments. I did not record this live. I am traveling. So if you're catching this live, put your questions in the comments and I'll be sure to catch it later. If you're catching this on a replay, still put your questions there. If you're on podcast land, the best place to ask your questions is on YouTube on the video that you're watching. And if you want to support this, the show, the Wild Wisdom Show, the number one way to do that is to go to YouTube channel and subscribe to my channel. And the number way to support your loved ones is to share this video. Sharing is caring, and you never know when someone's going to benefit from this wild wisdom. I hope you have a wonderful rest of your evening, day, or night, depending on when you catch this. And I'll see you next time.